Question 1. You are working with a client who engages in tantrum behavior that lasts for varying amounts of time. You need to collect data on how long each tantrum lasts from beginning to end. Which type of measurement should you use? A. Frequency. B. Duration. C. Latency. D. Partial interval recording. Answer B. Duration. This question is testing your understanding of different measurement procedures used in ABA. The keyword here is how long, which tells you need to measure the length of time a behavior occurs. Frequency counts how many times a behavior happens. Latency measures the time between something happening and the behavior starting, and partial interval recording is a way to check if a behavior happens at all during short periods of time, not how long it lasts. Duration is the specific measurement that records the total time a behavior occurs from start to finish. For example, if a tantrum starts at 5 p.m. and ends at 10 p.m., the duration is 5 minutes. So when you need to know how long a behavior lasts, think duration. Question 2. Your supervisor asks you to collect data on a client's screaming behavior. They tell you to mark if the screaming occurs at any point during a 10-second interval. You do this for a 30-minute session. What type of discontinuous measurement are you using? A. Whole interval recording. B. Momentary time sampling. C. Partial interval recording. D. Duration recording. Answer C. Partial interval recording. This question is asking about different ways to measure behavior that don't involve counting every single instance or moment. These are called discontinuous measurements. The key phrase here is, if the screaming occurs at any point during a 10-second interval. This perfectly describes partial interval recording, where you mark the interval if the behavior happens at all during that short time block, even just for a second. Whole interval recording requires the behavior to happen for the entire interval, and momentary time sampling only checks if the behavior is happening at the very end of the interval. Duration recording measures how long a behavior lasts, which isn't what's described. Partial interval recording is useful for behaviors you want to decrease, as it often overestimates how much the behavior happens. Remember, partial means it just has to show up for part of the interval. Question 3. You are teaching a client to follow the instruction, touch your nose. You say, touch your nose, and immediately guide their hand to their nose. What type of prompt are you using? A. Gestural prompt. B. Verbal prompt. C. Full physical prompt. D. Model prompt. Answer C. Full physical prompt. This question is about prompts, which are helpers you use to make it more likely a client will do the correct behavior when you give an instruction. You said, touch your nose. That's the instruction or discriminative stimulus, and then you guided their hand all the way to their nose. Guiding their body using touch is a physical prompt. Since you guided their hand the whole way, it's a full physical prompt. A gestural prompt would be pointing, a verbal prompt would be giving an extra spoken clue, and a model prompt would be you touching your nose for them to copy. If you're physically helping them do the action, think physical prompt. Question 4. A client typically throws toys when they are asked to clean up. This behavior has been happening more often lately. Your supervisor wants you to figure out why the client is throwing toys. What kind of assessment is this focused on? A. Preference assessment. B. Skills assessment. C. Functional assessment. D. Developmental assessment. Answer C. Functional assessment. This question is asking about the different types of assessments used in ABA. The key word is why in relation to the toy throwing behavior. Functional assessment is specifically designed to understand the function or purpose of a behavior, essentially what the client gets out of doing it. It helps you figure out why the behavior is happening. A preference assessment finds out what someone likes, a skills assessment checks what skills they have, and a developmental assessment looks at typical age-based milestones. If you need to know the why behind a behavior, you need a functional assessment to find its purpose. Question 5. Your client loves playing with cars. Your supervisor suggests using car time as a reward for completing tasks. When the client finishes their puzzle, you immediately let them play with cars for 5 minutes. What is the car play in this scenario? A. A discriminative stimulus, SD. B. An antecedent. C. A consequence. D. An extinction burst. Answer: C. A consequence. This question is about the ABCs of behavior. Antecedent behavior consequence. An antecedent is what happens right before the behavior. The behavior is the action the client does. A consequence is what happens right after the behavior. In this scenario, the client finishing the puzzle is the behavior, and getting to play with cars happens after that behavior. Therefore, the car play is a consequence, specifically because it's something the client loves and is given after a desired behavior to make it more likely to happen again. It's a form of reinforcement. Consequences happen after the behavior. Question 6. You are working with a client on identifying colors. You hold up a red card and say, "Touch red." The client touches the red card. The instruction, "Touch red," is an example of what turned from ABA. A. Behavior. B. Consequence. C. Discriminative stimulus, ST. D. Response. Answer: C. Discriminative stimulus, SD. This question asks you to identify a specific component within a learning trial in ABA, particularly in discrete trial training, DTT. The phrase "you hold up a red card and say, 'Touch red,' describes what you do before the client responds. The instruction you give, which signals that reinforcement is available if the client performs the correct behavior, touching red, is called a discriminative stimulus, or SD for short. It sets the occasion for a specific response. The client touching the card is the response, and anything that happens after, like praise or a token, is the consequence. The SD is your instruction or cue for the client to do something. Question 7. A client typically bites their hand when they are frustrated. Your team decides that every time the client bites their hand, you will ignore it and immediately prompt them to use a safe hands gesture instead, providing praise when they do the gesture. This procedure that involves withholding reinforcement for the problem behavior, biting, and providing reinforcement for an alternative behavior, safe hands, is called what? A. Extinction. B. Punishment. C. Differential reinforcement of an alternative behavior, DVRA. D. Timeout. Answer: C. Differential reinforcement of an alternative behavior, DVRA. This question describes a behavior reduction procedure that is commonly used in ABA. The key elements are withhold reinforcement for the problem behavior, biting, and providing reinforcement for an alternative behavior, safe hands. This exact combination of ignoring the problem behavior and reinforcing a specific, more appropriate behavior that replaces the problem behavior is called differential reinforcement of an alternative behavior, DRA. Extinction alone just means withholding reinforcement for the problem behavior. Punishment involves adding or removing something to decrease future behavior. Timeout involves removing the client from a reinforcing environment. DRA is a great strategy because you're teaching and rewarding a replacement behavior. Question 8. You are teaching a client to wash their hands. You've broken the skill down into small steps. 1. Turn on water. 2. Wet hands. 3. Get soap. 4. Rub hands, etc. You teach the client the first step, turn on water, and provide reinforcement. Once they master that, you teach the second step, wet hands, and provide reinforcement. You will continue teaching one step at a time in the order the steps usually occur. What teaching procedure is this? A. Shaping. B. Discrete trial training, DTT. C. Forward chaining. D. Total task chaining. Answer: C. Forward chaining. This question describes a procedure used to teach complex skills that involve multiple steps, like washing hands. The key clue is that you've broken the skill into steps, and you are teaching them one step at a time in the order they normally happen. Starting with the first step. Teach the client the first step. Once they master that, you teach the second step. This is exactly what forward chaining is, teaching steps from the beginning of the chain to the end, one by one. Shaping teaches the single behavior by rewarding closer and closer attempts. DTT is a structured teaching method using trials. Total task chaining teaches the client to attempt all steps in the chain every time, providing prompts as needed and reinforcing completion of the whole chain. If you're teaching step by step from beginning to end, think forward chaining. Question 9. Your client used to only say more please when they wanted more juice. Now they say more please when they want more crackers, more toys, or more tickles. The client is using the phrase more please in different situations and with different items. What behavior principle does this demonstrate? A. Discrimination. B. Extinction. C. Generalization. D. Spontaneous recovery. Answer: C. Generalization. This question is asking about how learned behaviors show up in new or different situations. The key phrase is that the client is using the same behavior, more please, in different situations and with different items: juice, crackers, toys, tickles. When a behavior that was taught in one specific situation starts happening in other similar situations or with different but related items, that's called generalization. Discrimination is the opposite, doing the behavior in one specific situation but not others. Extinction is stopping reinforcement to decrease behavior. Spontaneous recovery is a behavior temporarily popping back up after extinction. If a skill spreads to new places or things, it's generalizing. Question 10. You are collecting ABC data on a client's hitting behavior. You record that the client's mom told them no computer. The client then hit their mom, and the mom walked away. In this example, what is the A? A. The client hit their mom. B. The mom walked away. C. The client's mom told them no computer. D. The client wanting to use the computer. Answer: C. The client's mom told them no computer. This question is about understanding the different parts of the ABC data collection process. ABC stands for antecedent, behavior, and consequence. The antecedent, A, is what happens immediately before the behavior. The behavior, B, is the specific action the client does. The consequence, C, is what happens immediately after the behavior. In this scenario, the client's mom told them no computer happened right before the client hit their mom. Therefore, the antecedent, A, is the mom's instruction. The hitting is the behavior, B, and the mom walking away is the consequence, C. The antecedent is the trigger or event right before the behavior happens. Question 11. A client frequently screams when it is time to transition from playing to doing schoolwork. Based on this scenario alone, what is a possible function of the screaming? A. Attention. B. Access to tangibles. C. Escape. D. Automatic reinforcement. Answer: C. Escape. This question asks you to think about the possible function, purpose, of a behavior based on a brief description of the situation. The keyword here is transition from playing to doing schoolwork. This often involves moving from a preferred activity, playing, to a less preferred one, schoolwork, when a behavior occurs when a demand is placed, or when a transition to something less desirable is required. A very common function is escape. The behavior helps the client avoid or get out of that situation. Attention would be if the behavior got them attention. Access to tangibles would be if the behavior got them an item. Automatic reinforcement means the behavior feels good or provides a sensation to the client internally. In this case, screaming during a transition strongly suggests the behavior might be helping them escape the unpleasant transition. Question 12. Your supervisor asks you to take data using whole interval recording for a client's on-task behavior. The interval is set for 1 minute. You mark that the behavior occurred only if the client was on task for the entire 1-minute interval. If the client was on task for 50 seconds and off task for the last 10 seconds, how would you record for that interval? A. Mark that the behavior occurred. B. Mark that the behavior did not occur. C. Mark that the behavior occurred for 50 seconds. D. Use partial interval recording instead. Answer B. Mark that the behavior did not occur. This question tests your understanding of whole interval recording, a type of discontinuous measurement. The key instruction is mark that the behavior occurred only if the client was on task for the entire 1-minute interval. In the example, the client was on task for 50 seconds, but then off task for 10 seconds. Since they were not on task for the entire 60-second interval, you would mark that the behavior did not occur for that specific interval. Whole interval recording typically underestimates behaviors that happen for only a short time within an interval and is often used for behaviors you want to increase because you only give credit if it happens constantly. If it doesn't last the whole interval, it doesn't count in whole interval recording. Question 13. An RBT is working with a client. The client's parent pulls the RBT aside at the end of the session and asks them about the progress of another child the RBT also works with in a different family. How should the RBT respond? A. Share general information about the other child's progress without using their name. B. Politely explain that they cannot share information about other clients due to confidentiality. C. Tell the parent to ask their supervisor about the other child. D. Share the information because both children receive services from the same agency. Answer. B. Politely explain that they cannot share information about other clients due to confidentiality. This question is about ethics and professional conduct, specifically maintaining client confidentiality. As an RBT, you are bound by ethical codes and AIPA. Privacy laws. To protect the privacy of your clients, you absolutely cannot share any information about one client with another client's family, even if they attend the same agency or program. It's crucial to be polite but firm and explain that you are unable to discuss other clients' information due to privacy reasons. Sharing information, even without a name, is a breach of confidentiality. Telling them to ask your supervisor is also inappropriate, as the supervisor is also bound by confidentiality. Remember, your client's information is private and should only be discussed with authorized people directly involved in their care, like your supervisor and their treatment team. Question 14. You are teaching a client to imitate actions. You say, "Do this," and clap your hands. The client then claps their hands. The client's clapping is considered the A. Discriminative stimulus, SD. B. Antecedent. C. Response. D. Consequence. Answer. C. Response. This question is another one about the ABCs of behavior in a teaching trial. The antecedent is what happens right before the behavior, which in this case is you saying, "Do this," and clapping your hands. That's the SD and the model. The client's action following your instruction and model is called the response. The consequence is what happens right after the client claps, like praise or token. So, the client's behavior that occurs after you give the instruction is the response. It's their reaction to your cue. Question 15. Your supervisor asks you to use a token board with a client who loves dinosaurs. The client earns a dinosaur token for completing a task. After earning 5 dinosaur tokens, the client can trade them in for 5 minutes of playtime. In this system, the dinosaur tokens are considered what? A. Primary reinforcers. B. Conditioned reinforcers. Secondary reinforcers. C. Punishers. D. Unconditioned stimuli. Answer. B. Conditioned reinforcers. Secondary reinforcers. This question is about different types of reinforcers. Reinforcers are things that, when they happen after a behavior, make that behavior more likely to happen again. Primary reinforcers are naturally reinforcing because they are tied to basic needs like food, water, warmth. Conditioned reinforcers, also called secondary reinforcers, are things that weren't originally reinforcing but have become reinforcing because they've been paired with primary or other conditioned reinforcers. Tokens, money, praise, and stickers are common examples of conditioned reinforcers. They only have value because they can be exchanged for something else reinforcing, like playtime in this case. Punishers decrease behavior, and unconditioned stimuli are things that naturally trigger a response without prior learning. Tokens are classic examples of conditioned or secondary reinforcers because their value is learned by trading them for something preferred. Question 16. A client has a history of throwing toys when they are alone in a room. Your team suspects the behavior might be happening because it results in adult attention. What is the suspected function of the toy throwing in this scenario? A. Escape. B. Tangible. C. Attention. D. Automatic. Answer: C. Attention. This question asks you to identify the possible function of a behavior based on a description. The key clue is that the behavior, throwing toys, happens when the client is alone in a room and the team suspects it happens because it results in adult attention. If a behavior consistently leads to getting attention from others, even negative attention like someone coming to tell them to stop, the function is likely attention. Escape would be getting out of a demand. Tangible would be getting an item. Automatic reinforcement would be something internal, like a sensation or self-stimulation. In this case, the connection between being alone and getting attention via the behavior points strongly to attention as the function. Question 17. You are taking data on the time between when you tell a client clean up and when they start picking up toys. What dimension of behavior are you measuring? A. Duration. B. Frequency. C. Latency. D. Interresponse time. IRT. Answer: C. Latency. This question tests your knowledge of different ways to measure behavior. The key phrase is the time between when you tell a client clean up and when they start picking up toys. This specifically measures the time elapsed from the presentation of a stimulus, your instruction, to the initiation of the behavior. That specific time gap is called latency. Duration measures how long the behavior lasts once it starts. Frequency counts how many times the behavior happens. Interresponse time, IRT, measures the time between two consecutive instances of the same behavior. Latency is all about that startup time after a cue. Question 18. You are tracking a client's hitting behavior. You record the time the first hit occurs and the time the second hit occurs. You then calculate the time between the end of the first hit and the beginning of the second hit. What dimension of behavior are you measuring? A. Duration. B. Latency. C. Frequency. D. Interresponse time. IRT. Answer: D. Interresponse time. IRT. This question asks about measuring the time between occurrences of a repeated behavior. The key phrasing is the time between the end of the first hit and the beginning of the second hit. This measures the time elapsed between two consecutive instances of the same behavior. This specific measure is called interresponse time, IRT. Duration measures how long a single instance of the behavior lasts. Latency measures the time from a stimulus/cue to the start of the behavior. Frequency counts how many times the behavior happens. IRT is the time between two back-to-back behaviors. Question 19. An RBT is reviewing session notes written by another RBT on the same case. They notice that the other RBT frequently uses subjective language, like the client was angry or he seemed frustrated. Why is it important for RBTs to avoid subjective language in their notes? A. Subjective language makes the notes too long. B. Subjective language is not professional. C. Subjective language is based on opinions or interpretations, not objective, observable facts. D. Subjective language is only okay for supervisors to use. Answer: C. Subjective language is based on opinions or interpretations, not objective, observable facts. This question is about proper documentation and reporting in ABA, emphasizing the importance of objectivity. The core issue with subjective language, like angry or frustrated, is that it's based on your personal feelings or interpretation of what you think the client is feeling, rather than what you can actually see or hear them doing. ABA focuses on observable and measurable behavior. Objective language describes actions, example, client furrowed eyebrows and yelled, which different people can agree on seeing. While professionalism is important, the reason objective language is required is its focus on observable facts, which is fundamental to ABA data collection and analysis. Stick to reporting what you saw and heard, not what you thought was going on inside their head. Question 20. You are teaching a client to put on a shirt using backward chaining. The steps are: 1. Put arms in holes. 2. Pull overhead. 3. Pull down using backward chaining. Which step would you teach first? A. 1. Put arms in holes. B. 2. Pull overhead. C. 3. Pull down. D. You would teach all steps at once. Answer: C. 3. Pull down. This question is about backward chaining, a procedure for teaching multi-step skills. In backward chaining, you teach the steps of the skill in reverse order from the last step to the first. You do all the steps for the client except the very last one, and you prompt and reinforce the client for doing that last step. Once they master the last step, you do all steps except the last two, and prompt/reinforce for those, and so on, until the client can do the entire chain from beginning to end. So for putting on a shirt, the last step is pull down, which is the step you would teach first in backward chaining. It's called backward because you start at the end. Question 21. A client engages in hand flapping behavior. Your team suspects this behavior is automatically reinforcing because it occurs even when no one else is around and doesn't result in getting items or escaping demands. What kind of function is the team suspecting? A. Socially mediated. B. Non-socially mediated, automatic. C. Tangible. D. Attention. Answer: B. Non-socially mediated, automatic. This question is asking about the suspected function of a behavior. The key clue is that the behavior, hand flapping, occurs even when no one else is around and doesn't seem tied to getting attention, items, or escaping something. Behaviors that are maintained by something happening within the person themselves, without needing another person or external consequence, are called automatically reinforced behaviors. This is also referred to as non-socially mediated reinforcement. Socially mediated functions, attention, tangible, escape, involve another person providing the consequence. If the behavior seems to happen because it feels good or provides some internal sensation, and it happens even when they are alone, think automatic. Question 22. You are preparing to run a discrete trial training, DTT, program with your client. What is a key characteristic of DTT? A. It happens in the client's natural environment. B. Trials are presented rapidly, with a clear beginning and end. C. The client initiates the interaction. D. It focuses only on reducing problem behaviors. Answer: B. Trials are presented rapidly, with a clear beginning and end. This question is about discrete trial training, DTT, a common teaching method in ABA. DTT is very structured and differs from teaching in a natural environment. Key characteristics of DTT include presenting learning opportunities, trials, one after another with a clear start, the instructions/SD, and end, the consequence. Trials are typically kept short and presented fairly quickly to maximize learning opportunities. Teaching in the natural environment, like during play, is called naturalistic teaching or natural environment training. NAT. In NAT, the client often initiates the interaction and teaching happens organically. DTT is a structured, fast-paced way to teach skills in a more controlled setting. Think of DTT as breaking skills into tiny pieces and practicing them many times in a row at a table or designated area. Question 23. An RBT is collecting frequency data on a client's hitting behavior. In a 30-minute session, the client hit 7 times. The RBT should record A. Duration, 7 times. B. Frequency, 7. C. Latency, 7. D. IRT, 7. Answer B. Frequency, 7. This question tests your understanding of basic measurement procedures. Frequency is simply a count of how many times a specific behavior occurs during a given observation period. The question states the client hit 7 times. Therefore, the frequency of the hitting behavior is 7. Duration measures the length of the behavior. Latency measures the time from a cue to the start of the behavior. IRT measures the time between instances of the same behavior. If you are counting how many times something happens, you're measuring frequency. Question 24. A client is learning to mand, request, for items. They currently say car to request a car. Your supervisor wants you to teach them to say toy to request other preferred toys like a train or a plane. You will give them the toy when they say toy. You are teaching the client to use one word, toy, to ask for different but similar things. This is an example of teaching. A. Listener responding. B. Intraverbal. C. Tact. D. Generalization. Specifically, response generalization or stimulus generalization, but within mands. Answer D. Generalization. Specifically, response generalization or stimulus generalization, but within mands. This question is a bit more complex, asking about applying a concept, generalization, within a specific verbal behavior, manding. The client already mands for car. You are now teaching them to use a different word, toy, to ask for multiple other items, train, plane. This involves either using a new response, toy, for similar items, stimulus generalization of the item, or using a slightly different form of mand, toy instead of specific names, across items. The core idea is teaching the client to use their language skill, manding more broadly across different but related items, which is the essence of generalization. Listener responding is following instructions. Intraverbal is responding to someone else's words, like answering questions. Tact is labeling something in the environment. While you are teaching a mand, request. The primary concept, illustrated by asking for different toys with one word, is the broadening or generalization of the response/stimulus control within the manding repertoire. A simpler way to think about it is they are generalizing their manding skill to a new, broader category. Question 25. An RBT is running a DTT program. The client gives an incorrect response. What should the RBT do immediately after an incorrect response in DTT? A. Prompt the correct response and deliver reinforcement. B. Say no or incorrect. C. Withhold reinforcement and clear the trial. D. Take a break and come back to the trial later. Answer C. Withhold reinforcement and clear the trial. This question is about the specific procedure in discrete trial training, DTT, following an incorrect response. In DTT, if the client responds incorrectly, the standard procedure is to withhold reinforcement because they didn't do the target behavior, and then clear the materials or pause briefly before presenting the next trial. This helps maintain the clear structure and contingency. Correct response gets reinforcement, incorrect doesn't. Saying no or incorrect is generally avoided as it can be punishing. Prompting and reinforcing immediately after an incorrect response without a correction procedure isn't the standard DTT protocol for errors. Taking a break might happen later, but not as the immediate reaction to each incorrect response. The key in DTT errors is typically to withhold reinforcement and move on or use a specific error correction procedure if taught by your supervisor. The basic immediate step is withholding reinforcement and clearing the trial. Question 26. Your supervisor tells you to use prompting hierarchy when teaching a new skill, starting with the least intrusive prompt and only moving to more intrusive prompts if needed. What kind of prompting strategy is this? A. Most to least prompting. B. Least to most prompting. C. Simultaneous prompting. D. Time delay prompting. Answer: B. Least to most prompting. This question describes a specific strategy for using prompts based on how much help you provide. The instruction starting with the least intrusive prompt and only moving to more intrusive prompts if needed perfectly defines least to most prompting. You start with the smallest hint, least help, and only give more help, more intrusive prompts, if the client doesn't respond or responds incorrectly. Most to least is the opposite, starting with the biggest hint and gradually reducing the amount of help. Simultaneous prompting involves presenting the prompt at the same time as the instruction. Time delay involves waiting a bit after the instruction before giving a prompt. If you're starting with the least help and increasing it as needed, you're using least to most. Question 27. An RBT is working with a client on sorting shapes. The RBT presents the instruction sort by shape. This instruction is designed to occasion the sorting behavior. This instruction serves as a A. Consequence. B. Reinforcer. C. Punisher. D. Antecedent. Answer: D. Antecedent. This question is about the A in ABC. Antecedent, behavior, consequence. The antecedent is what happens right before the behavior you are interested in. In a teaching scenario, the instruction you give to the client, sort by shape, is the antecedent because it sets the stage for the client to perform the sorting behavior. Consequences happen after the behavior. Reinforcers and punishers are types of consequences. The instruction is the event that happens before the client's response, making it the antecedent. Question 28. You are teaching a client to fold clothes. You have a task analysis, list of steps. You provide prompting and reinforcement for every step of the folding process each time you practice. Which chaining procedure is this most likely describing? A. Forward chaining. B. Backward chaining. C. Total task chaining. D. Shaping. Answer: C. Total task chaining. This question is about chaining procedures for multi-step skills. The key phrase is you provide prompting and reinforcement for every step of the folding process each time you practice. In total task chaining, the client is prompted to perform all steps of the task analysis during each teaching trial, and reinforcement is typically provided after successfully completing the entire chain, although some reinforcement can be given for completing individual steps depending on the learner. Forward chaining teaches steps from the beginning first, backward chaining teaches steps from the end first, and shaping teaches a single behavior through successive approximations. If you're working through the whole list of steps every time, it's total task chaining. Question 29. A client usually takes 10 minutes to transition from the playroom to the therapy room. Your supervisor wants you to measure how long this transition takes each day. What dimension of behavior are you measuring? A. Duration. B. Latency. C. Frequency. D. Interresponse time, IRT. Answer: B. Latency. This question is similar to a previous one, but uses a different example. Transition from the playroom to the therapy room. The question asks to measure how long this transition takes. A transition involves a cue, like being told it's time to go to the therapy room, and the start of the action, leaving the playroom, walking towards the therapy room. Measuring the time from the cue to the start of the transition behavior is specifically measuring latency. Duration would be how long the act of moving itself took once it started. Frequency would be how many transitions happened. IRT measures time between two instances of the same behavior. Transition time from a cue is a classic example of measuring latency. Question 30. An RBT is working on a skill acquisition program. The client is having difficulty learning the skill even with prompts. The RBT suspects the reinforcer being used isn't motivating the client. What should the RBT do? A. Continue using the same reinforcer because it's listed in the plan. B. Stop the program and wait for the supervisor to visit. C. Inform the supervisor about the lack of motivation and suggest conducting a new preference assessment. D. Use edible reinforcers without asking the supervisor. Answer: C. Inform the supervisor about the lack of motivation and suggest conducting a new preference assessment. This question is about the RBT's role in implementing programs and communicating with their supervisor. If a program isn't working as expected, client isn't learning, and you suspect the reinforcer isn't motivating, it's your responsibility to communicate this to your supervisor. They are the ones who design and modify the treatment plan. Suggesting a preference assessment is a great idea because it's how you find what is motivating. You should never change the plan or introduce new types of reinforcers, like edibles, without explicit instruction from your supervisor. Continuing a plan that isn't working without reporting it is also inappropriate. Your role is to implement, observe, collect data, and report to your supervisor so they can make decisions. Question 31. A client receives a sticker for every correct response during a learning task. After earning 5 stickers, they can trade them for 1 minute of tablet time. This is an example of what type of reinforcement schedule? A. Continuous reinforcement, CRF. B. Fixed ratio, FR. C. Variable ratio, VR. D. Fixed interval, FI. Answer: B. Fixed ratio, FR. This question asks about a specific schedule of reinforcement. The key phrase is for every correct response, they get a sticker, and they need 5 stickers to get the tablet time. This means reinforcement, the sticker, is delivered after a fixed number of responses, 1 correct response. Earning the tablet time is contingent on a fixed number of stickers, 5 responses. A fixed ratio schedule, FR, provides reinforcement after a specific, unchanging number of responses. CRF is reinforcement for every single response, FR1. VR provides reinforcement after an average number of responses. FI provides reinforcement for the first response after a fixed amount of time. Getting a sticker for each response is an FR1, and getting tablet time for 5 stickers is like a larger FR contingency. The structure clearly involves a fixed number of responses leading to reinforcement. Question 32. Your supervisor asks you to collect data on a client's making eye contact behavior using momentary time sampling. The interval is set for 30 seconds. At the end of each 30-second interval, you look at the client. If they are making eye contact at that exact moment, you mark it. If not, you don't mark it. What makes this different from partial or whole interval recording? A. You only look at the behavior at the very end of the interval. B. The interval length is fixed. C. It measures how long the behavior occurs. D. It is used for behaviors you want to decrease. Answer: A. You only look at the behavior at the very end of the interval. This question focuses on the specific defining feature of momentary time sampling. The description explicitly states, at the end of each 30-second interval, you look at the client. If they are making eye contact at that exact moment, you mark it. This is the core difference between momentary time sampling and the other interval methods. Partial interval marks if the behavior occurs at any point during the interval. Whole interval marks if the behavior occurs for the entire interval. Momentary time sampling only requires the behavior to be happening at the single specific moment the interval ends. Interval length being fixed is true for all 3 interval methods. It doesn't measure duration. It can be used for behaviors you want to increase or decrease, but its defining characteristic is checking only at the interval's end. Question 33. A child screams whenever their parent leaves the room. The screaming stops when the parent returns. The parent returning functions as a reinforcer for the screaming. What is the likely function of the screaming? A. Escape. B. Tangible. C. Attention. D. Automatic. Answer: C. Attention. This question asks about the function of behavior based on the ABC data. The antecedent is the parent leaving, the behavior is screaming, and the consequence is the parent returning. Since the parent returning, which provides attention, Makes the screaming more likely to happen in the future when the parent leaves. The function is likely attention. The child's screaming is reinforced by getting the parent's attention back. Escape would be getting away from something. Tangible would be getting an item. Automatic would be internal. This scenario clearly shows the behavior is reinforced by social interaction. Attention. Question 34. An RBT is asked to teach a client to identify pictures of animals. The RBT presents 3 pictures: dog, cat, bird, and says, touch dog. This is an example of which skill acquisition program? A. Intraverbal training. B. Tact training. C. Listener responding, receptive ID. D. Man training. Answer C. Listener responding, receptive ID. This question is about different types of verbal behavior or communication skills taught in ABA. The RBT says the name of the item, touch dog, and the client has to listen to the instruction and identify or select the correct picture. This is the definition of listener responding, sometimes called receptive identification. The client is responding as a listener. Intraverbal training involves responding to spoken words without the item present, like answering questions. Tact training is labeling or naming things. What is it? Man training is requesting. What do you want? If the client has to listen and find the correct item based on your spoken word, it's listener responding. Question 35. When teaching a new skill, you start by providing a lot of help, like a full physical prompt. As the client starts to learn, you gradually provide less and less help, moving to partial physical, then gestural, then no prompt. This process of reducing the amount of prompting is called A. Shaping. B. Chaining. C. Stimulus fading. D. Prompt fading. Answer D. Prompt fading. This question describes the process of systematically reducing prompts as a client learns a skill. The key phrase is gradually provide less and less help. This process is specifically called prompt fading. You are making the prompt less obvious or less intrusive over time, so the client learns to perform the behavior with less assistance, eventually responding only to the natural instruction. The SD. Shaping teaches a new behavior by reinforcing closer attempts. Chaining teaches multi-step skills. Stimulus fading involves gradually changing a physical property of the learning materials themselves, like making a picture less bright, not the amount of help from you. When you reduce your help, you're fading the prompt. Question 36. An RBT is asked to deliver reinforcement every 5 minutes that a client does not engage in hitting behavior. If the client hits, the timer resets. This is an example of what type of differential reinforcement? A. Differential reinforcement of other behavior. DRO. B. Differential reinforcement of alternative behavior. DRA. C. Differential reinforcement of incompatible behavior. DRI. D. Differential reinforcement of low rates. DRL. Answer A. Differential reinforcement of other behavior. DRO. This question describes a specific differential reinforcement procedure. The RBT is reinforcing the client for not doing the hitting behavior for a specific period of time, every 5 minutes that a client does not engage in hitting. This is called differential reinforcement of other behavior. DRO. You reinforce the absence of the target behavior during an interval. DRI reinforces a specific alternative behavior. DRI reinforces a specific behavior that is impossible to do at the same time as the problem behavior. DRL reinforces the behavior when it happens at a lower rate than before. If you're reinforcing for the behavior not happening at all within a time frame, think DRO. Reinforcing for any other behavior happening or no behavior happening besides the target problem behavior. Question 37. You are tracking how long a client spends engaging in a specific leisure activity during a free play session. What dimension of behavior are you measuring? A. Frequency. B. Duration. C. Latency. D. Interresponse time. IRT. Answer B. Duration. This question asks you to identify the correct measurement for a behavior. The key phrase is how long a client spends engaging in a specific leisure activity. When you measure the total amount of time a behavior occurs from start to finish, you are measuring its duration. Frequency counts instances. Latency measures time from a cue to the start. IRT measures time between instances. If you're timing how long something lasts, use duration. Question 38. An RBT is teaching a client to label objects, example, saying ball, when shown a picture of a ball. Which type of verbal behavior is the RBT teaching? A. Mand. B. Tact. C. Intraverbal. D. Echoic. Answer: B. Tact. This question is about B. F. Skinner's analysis of verbal behavior. The RBT is showing the client an object, picture of a ball, and teaching them to name or label it. Ball. This type of verbal behavior, where the speaker names something in the environment based on what they see, hear, smell, touch, or taste, is called a tact. A mand is a request. An intraverbal is responding to someone else's language, like answering a question. An echoic is repeating what someone else says. If you are teaching someone to label or name something they perceive in the environment, you are teaching a tact. Question 39. You are teaching a client to match pictures of animals. You show them a picture of a dog and ask them to find the matching picture from a group of pictures. This is an example of teaching. A. Listener responding. B. Visual perception matched to sample. VPMTS. C. Tact. D. Intraverbal. Answer: B. Visual perception matched to sample. VPMTS. This question is about a specific type of visual discrimination skill taught in ABA. You are showing the client a sample item, picture of a dog, and asking them to choose the identical or related item from a set of options. This procedure is called match to sample, and because it involves matching visual items, it's specifically visual perception match to sample, VPMTS. Listener responding involves following verbal instructions. Tact is labeling. Intraverbal is responding to questions or filling in blanks. When you ask a client to find the one that is the same as the example, you are teaching a matching skill. Question 40. During a session, a client's parent asks the RBT to change a goal that is written in the treatment plan because they don't think it's important. How should the RBT respond? A. Agree with the parent and start working on a different goal. B. Politely explain that changes to the treatment plan must be made by the supervisor. C. Tell the parent they must discuss it with the agency director. D. Explain why the goal is important based on their own clinical judgment. Answer: B. Politely explain that changes to the treatment plan must be made by the supervisor. This question is about the RBT's scope of practice and professional boundaries. As an RBT, you are responsible for implementing the treatment plan as written by the supervisor or BCBA. You do not have the authority to change goals or make decisions about the treatment plan yourself. If a parent wants to make changes, you should respectfully explain that you will pass their feedback along to your supervisor, who is the qualified professional responsible for modifying the plan. You shouldn't make changes yourself. Tell them to talk to someone else higher up without involving your supervisor, or give your own clinical opinion about the goal's importance. Your role is to implement and communicate concerns or requests to your supervisor. Question 41. A client engages in throwing items when they are in a busy, noisy environment. The behavior stops when they are moved to a quieter room. What is a possible function of the throwing behavior? A. Attention. B. Escape. C. Tangible. D. Automatic. Answer: B. Escape. This question asks about the potential function of a behavior based on the situation. The behavior, throwing items, happens in a busy, noisy environment, and it stops when the client is moved to a quieter room. This consequence, getting out of the noisy environment, reinforces the behavior by allowing the client to escape or avoid an unpleasant situation. Therefore, the likely function is escape. Attention would be getting social interaction. Tangible would be getting an item. Automatic would be internal reinforcement. When a behavior helps the client get away from something they don't like, the function is likely escape. Question 42. You are teaching a client to clap their hands. You say, clap hands, and the client does not respond. You wait 3 seconds, and then physically guide their hands to clap. A full physical prompt. What type of prompting procedure are you using here? A. Least to most prompting. B. Most to least prompting. C. Time delay prompting. D. Stimulus fading. Answer: C. Time delay prompting. This question describes a specific prompting procedure where you insert a delay between the instruction and the prompt. The key action is you wait 3 seconds and then physically guide their hands. This waiting period before providing the prompt is called time delay. It's used to give the client an opportunity to respond independently after the SD is given, before any extra help is provided. Least to most starts with less help and adds more. Most to least starts with more help and reduces it. Stimulus fading changes the materials. Time delay is specifically about inserting a pause after the instruction before prompting. Question 43. An RBT needs to collect data on how many times a client talks about dinosaurs during a session. Which dimension of behavior is most appropriate to measure? A. Duration. B. Frequency. C. Latency. D. Interresponse time, IRT. Answer: B. Frequency. This question is asking about measuring how often a specific behavior occurs. The phrase "how many times a client talks about dinosaurs" tells you need to count each instance of this behavior. Counting how many times a behavior happens is frequency measurement. Duration would be how long each instance lasted. Latency would be the time from a cue, like asking a question, to the start of them talking about dinosaurs. IRT would be the time between one instance of talking about dinosaurs and the next. If you're simply counting occurrences, use frequency. Question 44. You are working with a client who engages in aggressive behavior. Your supervisor instructs you that if the client becomes aggressive, you must ensure your own safety and the safety of the client and others first. This priority aligns with which core principle in ABA? A. Maintaining client dignity. B. Professionalism. C. Using evidence-based practices. D. Safety and security. Answer: D. Safety and security. This question is about the ethical and practical responsibilities of an RBT, particularly when dealing with challenging behaviors. While all the options are important principles in ABA, the instruction to ensure your own safety and the safety of the client and others first directly relates to the fundamental principle of safety and security. Before implementing any behavior plan or technique, ensuring everyone involved is safe is the absolute top priority. Client dignity, professionalism, and using evidence-based practices are crucial, but they are secondary to immediate safety in a crisis situation. Always prioritize safety first. Question 45. An RBT is recording data during a session. The client asks for juice, and the RBT gives them juice. This is an example of A. Punishment. B. Extinction. C. Reinforcement. D. Antecedent. Answer: C. Reinforcement. This question describes a simple interaction that likely involves reinforcement. The behavior is client asks for juice. This is a mand. The consequence is the RBT gives them juice. Since getting the juice, something the client likely wants, happens immediately after asking for it, and this makes it more likely the client will ask for juice again in the future when they want it. This is an example of reinforcement. Punishment decreases behavior. Extinction involves withholding reinforcement. The antecedent was likely the client wanting juice or seeing the juice. The consequence of receiving the desired item is reinforcing the demanding behavior. Question 46. A client receives praise and a high five immediately after they independently say more to request a swing push. This immediate delivery of reinforcement is important because it helps the client understand which behavior earned the reward. This principle is called A. Motivation, B. Pairing, C. Immediacy, D. Satiation. Answer C. Immediacy. This question is about the characteristics of effective reinforcement. The key phrase is immediately after they independently say more. Delivering the reinforcer right after the target behavior makes it very clear to the client which specific action led to the reward. This speed of delivery is called immediacy. Reinforcement is most effective when delivered immediately. Motivation is about the client's desire for the reinforcer. Pairing is associating something neutral with something reinforcing. Satiation is when the client has had too much of a reinforcer and it loses its value. The closer the consequence is in time to the behavior, the stronger the learning connection. That's immediacy. Question 47. You are teaching a client to build a tower with blocks. You start by reinforcing the client for stacking just one block. Then you only reinforce them for stacking 2 blocks. Then you only reinforce for stacking 3 blocks, and so on, gradually requiring more blocks to be stacked before providing reinforcement. What skill acquisition procedure is this? A. Chaining, B. Shaping, C. Prompting, D. Discrimination training. Answer B. Shaping. This question describes shaping, a procedure used to teach new behaviors by reinforcing successive approximations. You are not teaching a sequence of steps, chaining. You are teaching a single, more complex behavior, stacking more blocks, by rewarding behaviors that are closer and closer to the final target behavior. You start by reinforcing an easy version, 1 block, then a slightly harder version, 2 blocks, and so on until they do the full target behavior. Prompting is providing assistance. Discrimination training is teaching the client to respond differently to different stimuli. If you're rewarding closer and closer attempts at a single behavior, you're shaping. Question 48. An RBT is observing a client and writing down everything that happens before, during, and immediately after a specific behavior occurs. What type of data collection is the RBT using? A. Frequency count, B. Interval recording, C. Duration recording, D. ABC recording. Answer D. ABC recording. This question asks about a specific method for collecting descriptive data about behavior. The RBT is recording everything that happens before, during, and immediately after a specific behavior occurs. This is the definition of ABC recording. Antecedent, behavior, consequence. It helps you identify the triggers and outcomes associated with a behavior, which is crucial for functional assessment. Frequency, interval, and duration recording are methods for quantifying behavior, not for describing the environmental events surrounding it. If you're writing down the A, B, and C, you're doing ABC recording. Question 49. A client has learned to make their bed neatly. Your supervisor wants to ensure the client continues to make their bed neatly even after the reinforcement program is reduced or faded out. This focus on the behavior continuing over time is called A. Generalization, B. Maintenance, C. Discrimination, D. Spontaneous recovery. Answer B. Maintenance. This question is about a crucial aspect of successful skill acquisition programs, ensuring the learned skill lasts. The key phrase is ensuring the client continues to make their bed neatly even after the reinforcement program is reduced or faded out. Maintenance refers to the continuation of a learned behavior after the intervention that initially taught or increased it has been removed or reduced. Generalization is the behavior occurring in different settings or situations. Discrimination is responding differently to different stimuli. Spontaneous recovery is a behavior reappearing after extinction. If you want the skill to stick around for the long haul, you're focusing on maintenance. Question 50. An RBT is working with a client who sometimes bites their hand when they are frustrated. The BCBA has created a plan where the RBT will immediately give the client a preferred chewy toy that they can't bite their hand while using, whenever they see the client's frustration building. This is an example of which procedure? A. Punishment. B. Extinction. C. Antecedent-based intervention. Antecedent control. D. Differential reinforcement. Answer: C. Antecedent-based intervention. Antecedent control. This question describes a strategy that happens before the problem behavior occurs. The RBT is intervening whenever they see the client's frustration building, which is an antecedent, a trigger or warning sign before the biting might happen. By giving the chewy toy at this point, the RBT is proactively preventing the problem behavior or making it less likely by giving the client something incompatible or preferred to do instead. This is an example of an antecedent-based intervention, or manipulating the environment before the behavior to make the problem behavior less likely. Punishment happens after. Extinction is withholding reinforcement after. Differential reinforcement reinforces alternative behaviors after the problem behavior could have occurred. This strategy changes something before the behavior, making it antecedent control. Question 51. An RBT is graphing data for a client's behavior. The graph shows the percentage of intervals the behavior occurred in. Which measurement method was most likely used to collect this data? A. Frequency. B. Duration. C. Latency. D. Interval recording, partial, whole, or momentary. Answer: D. Interval recording, partial, whole, or momentary. This question asks about the type of measurement that results in data often reported as a percentage. Frequency, duration, latency, and IRT data are typically reported as counts, time units, or rates. Interval recording methods, partial, whole, and momentary time sampling, involve dividing the observation period into intervals and recording whether the behavior occurred during or at the end of those intervals. The data is then typically summarized as the percentage of intervals in which the behavior was recorded. If you see data presented as a percentage of observation time or intervals, it's a strong clue that some form of interval recording was used. Question 52. An RBT is working with a client who has difficulty staying seated during lessons. The supervisor has created a plan where the RBT will ignore any attempts by the client to get out of their seat. No attention, no reminders to sit, as long as the client is in a safe location. What behavior reduction procedure is primarily being used here? A. Punishment. B. Extinction. C. Differential reinforcement. D. Response cost. Answer: B. Extinction. This question describes the process of withholding reinforcement for a previously reinforced behavior. The behavior is getting out of their seat, and the plan is to ignore any attempts to get out of their seat, meaning no attention or other suspected reinforcement. If the client was previously getting reinforcement, like attention from the RBT or escape from the task, by getting out of their seat, and the RBT now withholds that reinforcement, this is the procedure of extinction. Punishment would involve adding something aversive or removing something preferred after the behavior. Differential reinforcement involves reinforcing another behavior. Response cost is taking away a reinforcer after the behavior. If you stop giving the client what they were getting from the behavior, it's extinction. Question 53. An RBT is running a program where the client is supposed to point to the picture of a cat when given the instruction, touch cat. The RBT presents pictures of a cat and a dog. When the RBT says, touch cat, the client points to the dog. This is an example of A. Correct response. B. Incorrect response. C. Unprompted response. D. Generalization. Answer: B. Incorrect response. This question describes the client's performance during a learning trial. The instruction, SD, was touch cat, and the client pointed to the dog. Since the client did not perform the behavior requested in the instruction, this is by definition an incorrect response. A correct response would be pointing to the cat. An unprompted response means they did it without a prompt, could be correct or incorrect. Generalization is performing a skill in new situations. In a teaching trial, if the response doesn't match the target behavior for that instruction, it's an incorrect response. Question 54. You are teaching a client to wash their hands using a picture schedule that shows each step. The client looks at the picture for wet hands, then turns on the water. The picture is helping to trigger the correct step. The picture schedule is acting as A. Consequence. B. Reinforcer. C. Stimulus control. D. Response. Answer. C. Stimulus control. This question is about how cues in the environment can influence behavior. The picture schedule is an environmental stimulus that signals or guides the client to perform the next step in the chain. The client looks at the picture for wet hands, then turns on the water. When a specific stimulus, like the picture, reliably causes a specific behavior to occur, that stimulus has gained stimulus control over the behavior. The client's behavior is under the control of the picture cue. Consequences happen after the behavior. A reinforcer is a type of consequence. A response is the behavior itself. The picture is the cue that controls the behavior. Question 55. An RBT is preparing for a session. The client loves trains, but the RBT notices that the client hasn't shown much interest in trains for the past few days. This could be an example of A. Deprivation. B. Satiation. C. Punishment. D. Establishing operation. Answer. B. Satiation. This question is about factors that affect the value of a reinforcer. The client usually loves trains, but recently hasn't been interested. This decrease in interest suggests the client might have had too much exposure to or access to trains lately, making them temporarily less reinforcing. This state is called satiation. Deprivation is the opposite, not having had enough of something, which makes it more reinforcing. Punishment decreases behavior. An establishing operation is something that changes the value of a reinforcer and makes behaviors that get that reinforcer more likely. Like being thirsty makes water more valuable. If the client seems over it, they might be satiated. Question 56. When collecting frequency data, it's important to have a clear definition of the behavior you are counting so that you and anyone else collecting data count the same thing. What is this clear, specific definition called? A. Subjective definition. B. Behavioral objective. C. Operational definition. D. Topographical definition. Answer. C. Operational definition. This question is about the importance of defining behaviors clearly in ABA. To ensure data is accurate and consistent across different observers, any behavior being measured must have a clear, objective, and measurable definition. This specific definition that describes the behavior in observable terms is called an operational definition. It explains exactly what the behavior looks like and what counts as an instance of the behavior. Subjective definitions are based on opinion. A behavioral objective is a goal statement. A topographical definition describes what the behavior looks like, but an operational definition often includes more details like intensity, duration, or context. Having a good operational definition ensures everyone is on the same page about what behavior they are measuring. Question 57. An RBT is teaching a client to say bubble to request bubbles. The RBT blows bubbles, and the client says bubble. The RBT gives them more bubbles. The RBT is teaching the client to use a word to ask for something they want. What type of verbal behavior is the RBT teaching? A. Tact. B. Echoic. C. Mand. D. Intraverbal. Answer. C. Mand. This question describes teaching the client to make a request. The client says bubble because they want more bubbles, and saying the word gets them what they want. A mand is a verbal behavior that is controlled by a desire or need, an establishing operation, and is reinforced by getting the specific item or action requested. The client is asking for something. Tact is labeling. Echoic is repeating. Intraverbal is responding to questions. If the client is asking for something using a word, it's a mand. Question 58. You are working with a client who engages in eloping. running away. The BCBA implements a plan where if the client stays seated during a 10-minute activity, they earn 2 minutes of free play. If they elope, they do not earn the free play for that interval. This is an example of reinforcing the absence of the eloping behavior. What type of differential reinforcement is this? A. DRA. Alternative behavior. B. DDRI. Incompatible behavior. C. DRL. Low rates. D. DRO. Other behavior. Answer. D. DRO. Other behavior. This question describes reinforcing the client for not engaging in a specific behavior, eloping, for a set period of time. If the client stays seated during a 10-minute activity, they earn 2 minutes of free play. If they elope, they do not earn the free play for that interval. This reinforces the absence of the target problem behavior during the interval. This is the definition of differential reinforcement of other behavior. DRO. While staying seated could be seen as an other behavior, the contingency is specifically tied to the non-occurrence of eloping within the interval, not necessarily the occurrence of sitting itself as the primary reinforced behavior. DRI reinforces a specific alternative. DRI reinforces an incompatible behavior. DRL reinforces a lower rate of the problem behavior. Reinforcing for not doing the behavior for a time is DRO. Question 59. An RBT is working with a client. The client offers the RBT a small handmade drawing as a gift. According to the RBT ethics code, how should the RBT handle this? A. Accept the gift as a nice gesture. B. Politely decline the gift, explaining the ethical guidelines. C. Accept the gift but give it to the supervisor later. D. Accept the gift only if it's inexpensive. Answer. B. Politely decline the gift, explaining the ethical guidelines. This question is about the RBT's ethical responsibility regarding gifts. RBTs must avoid dual relationships and conflicts of interest, which includes accepting gifts from clients or their families, regardless of the value. Accepting gifts can blur professional boundaries. The appropriate ethical response is to politely but firmly decline the gift and briefly explain, without being overly technical, that RBTs have rules about accepting gifts to maintain a professional relationship. You cannot accept it and keep it, give it away, or base the decision on the price. When in doubt about gifts, the safest and most ethical path is to decline. Question 60. You are teaching a client to build a puzzle. The puzzle has 5 pieces. The first time you present it, you put 4 pieces in and have the client put the last piece in. The next time, you put 3 pieces in and have the client put the last 2 in. You continue gradually putting fewer pieces in until the client can do the whole puzzle. What type of prompting or fading procedure does this resemble? A. Prompt fading. Physical. B. Stimulus fading. C. Shaping. D. Model fading. Answer. B. Stimulus fading. This question describes a procedure where you are changing a characteristic of the materials or the stimulus itself to make it easier for the client to respond correctly. You are making the task easier by having most of the puzzle already done, and then gradually fading out that assistance by putting fewer and fewer pieces in. This is an example of stimulus fading, changing the stimulus, the appearance or setup of the puzzle, to help the client learn to respond to the original, unmodified stimulus, the full puzzle. Prompt fading reduces the help you provide. Shaping works on one behavior by reinforcing approximations. Model fading is reducing the amount of a model you provide. Here, you're changing the picture/puzzle itself, which is stimulus fading. Question 61. An RBT is observing a client's hitting behavior. They decide to record whether the hitting occurs at all during a 10-minute observation period. If the client hits at least once during that 10 minutes, they mark it. If not, they don't. This simple yes/no data collection over a long period is called A. Frequency. B. Duration. C. Interval recording. D. Count per observation. Answer. C. Interval recording or sometimes referred to as occurrence/non-occurrence. This question describes a very basic form of discontinuous measurement, often used for behaviors that are difficult to track continuously or for very low rate or high rate behaviors. By dividing the entire observation into one single large interval, 10 minutes, and simply marking if the behavior occurred at all during that interval, you are essentially using a simplified form of interval recording, specifically partial interval recording over a single long interval. While you are counting occurrences within that interval, it's not a frequency count over a standard time unit, duration, or latency. The core process is breaking time into segments, even just one, and checking for occurrence, which falls under the umbrella of interval recording procedures. Question 62. A client consistently engages in hand flapping whenever they are waiting for a preferred activity. The behavior stops as soon as the preferred activity is provided. What is the likely function of the hand flapping? A. Attention. B. Escape. C. Tangible. Access. D. Automatic. Answer. C. Tangible. Access. This question asks about the function of behavior based on when it occurs and what happens afterward. The behavior, hand flapping, happens when the client is waiting for a preferred activity, and it stops as soon as the preferred activity is provided. This suggests the behavior is happening because it helps the client gain access to something they want, the preferred activity. Therefore, the likely function is access to tangibles or activities. Attention would be getting social interaction. Escape would be getting out of something unpleasant. Automatic would be internal. The behavior is happening to get something, pointing to an access/tangible function. Question 63. An RBT is collecting data using a new form. They are unsure if they are filling it out correctly. What should the RBT do? A. Do their best and assume it's correct. B. Stop collecting data until the supervisor is available. C. Ask the client or parent for help. D. Contact their supervisor for clarification and guidance. Answer. D. Contact their supervisor for clarification and guidance. This question is about the RBT's responsibility when they are unsure how to perform a task. RBTs must work under the close supervision of a BCBA. If you are ever unsure about how to implement a procedure, collect data, or handle a situation, your ethical and professional responsibility is to seek guidance from your supervisor immediately. Guessing or stopping data collection without reporting are not appropriate. Asking the client or parent for help on clinical procedures is outside your scope and unprofessional. Always reach out to your supervisor when you need help or clarification. Question 64. You are working with a client who has successfully learned to identify 10 different animals when you say their names. Example, touch dog, touch cat, etc. Now your supervisor wants you to teach them to identify animals from pictures they haven't seen before in a different room of the house and with a different therapist. This is focusing on promoting A. Maintenance. B. Satiation. C. Generalization. D. Discrimination. Answer. C. Generalization. This question describes the process of getting a learned skill to occur in new and different contexts. The client learned the skill with specific pictures and a specific therapist in one setting. Now the goal is for the skill, identifying animals, to happen with pictures they haven't seen before, in a different room, and with a different therapist. This is all about getting the skill to generalize across different stimuli, new pictures, different settings, different room, and different people, different therapist. Maintenance is about the skill lasting over time. Satiation is getting tired of a reinforcer. Discrimination is responding differently to different stimuli. Making the skill work everywhere is generalization. Question 65. An RBT is working on an imitation program. The RBT says, "Copy me," then claps their hands. The client claps their hands. What type of prompt is inherently built into this type of imitation trial? A. Verbal prompt. B. Physical prompt. C. Model prompt. D. Gestural prompt. Answer C. Model prompt. This question asks about the natural prompt used in imitation training. When you teach imitation, you say something like, "Copy me." That's a verbal SD. And then you show the client what to do, like clapping your hands. Showing the client the behavior you want them to copy is providing a model of the behavior. The client then imitates that model. Therefore, a model prompt is a fundamental part of imitation training, while you might use other prompts in addition, like physical guidance to help them clap. The act of showing them the behavior is the model prompt. Question 66. A client engages in loud vocalizations during lessons. The BCBA decides to use differential reinforcement of low rates, DRL. How would the RBT implement a DRL procedure for this behavior? A. Reinforce the client if they do not vocalize at all during the lesson. B. Reinforce the client if they vocalize a specific alternative behavior instead. C. Reinforce the client if the number of vocalizations during the lesson is below a certain number. D. Provide reinforcement every time the client is quiet. Answer C. Reinforce the client if the number of vocalizations during the lesson is below a certain number. This question asks about the implementation of a DRL procedure, DDRL. Differential reinforcement of low rates is used when you want to reduce the frequency of a behavior, but not eliminate it entirely. The reinforcement is delivered if the behavior occurs, but at a rate lower than a specified criterion example, no more than 3 vocalizations in 10 minutes. Option A. Describes DRO, reinforcing absence. Option B. Describes DRA or DRI, reinforcing alternative/incompatible behavior. Option D could be part of a DRO or another strategy, but doesn't specifically capture the essence of reinforcing a lower rate of the target behavior itself. DRL means the behavior still happens, but you only reinforce when it happens less often than before. Question 67. An RBT is told to collect data on a client's behavior using a percentage. Which of the following behaviors would most likely be measured using percentage? A. Number of times the client asks for a break in an hour. B. The total time the client spends engaging with peers during a play session. C. The number of correct responses out of the total opportunities given on a learning task. D. The time between the instruction, "sit down," and the client sitting down. Answer C. The number of correct responses out of the total opportunities given on a learning task. This question asks which type of measurement is commonly reported as a percentage. Percentage data is often used to represent accuracy or success rate on a task, calculated as number of correct responses/total number of opportunities, *100%. Measuring performance on a learning task with a set number of trials, like identifying pictures or following instructions, fits this perfectly. You count how many times they got it right out of how many times you asked. Frequency is a count. A. Duration is time. B. Latency is time. D. Accuracy on trials is typically reported as a percentage. Question 68. You are teaching a client to wave goodbye. You say, "Bye-bye," and the client doesn't respond. You physically help them wave their hand. Prompt. What should you do immediately after providing the physical prompt and the client waves? A. Deliver reinforcement example praise, token. B. Repeat the instruction, "Bye-bye." C. Wait for the client to wave again independently. D. Record the response as incorrect because it was prompted. Answer A. Deliver reinforcement example praise, token. This question is about what happens after a prompted correct response in a teaching trial. When a client responds correctly with the help of a prompt, you should still provide reinforcement. This helps the client associate the instruction/situation with the correct behavior, even though they needed help this time. While prompted responses are often recorded differently than independent ones, your data sheet should distinguish this. They are still reinforced, usually on a slightly less rich schedule or with less powerful reinforcers than independent correct responses, but reinforcement is still crucial for learning. Repeating the instruction isn't necessary right after a prompted response. Waiting for independent response only happens after you fade the prompt. Recording it as incorrect when they did the right behavior with help isn't accurate for tracking learning progress. Reinforce prompted correct responses to build the association. Question 69. An RBT is documenting a session. They write detailed notes about the program's run, the data collected, and any behaviors of concern that occurred. Why is accurate and objective session documentation important? A. It allows the RBT to be paid for the session. B. It is used by the supervisor to monitor progress and make treatment decisions. C. It serves as a journal for the RBT to reflect on the session. D. It is required by law in all circumstances. Answer B. It is used by the supervisor to monitor progress and make treatment decisions. This question emphasizes the primary purpose of session documentation in ABA. Accurate and objective session notes provide the supervisor, BCBA, with the information they need to track the client's progress on goals, analyze behavioral trends, evaluate the effectiveness of interventions, and make informed decisions about modifying the treatment plan. While documentation is often required for billing, A, and it can be a place for reflection, C, and laws like 8I BAA apply. D, the core clinical reason for documentation is to inform the supervisor's decision-making about the client's treatment. Your notes are the supervisor's eyes and ears when they aren't present. Question 70. An RBT is working with a client who has learned to point to many different body parts when asked example, touch head, touch nose, touch foot. Now when the RBT says touch elbow, the client points to their elbow the very first time, even though they were never specifically taught touch elbow before. This demonstrates A. Prompt dependency, B. Discrimination, C. Stimulus generalization within the listener responding repertoire, D. Response generalization. Answer C. Stimulus generalization within the listener responding repertoire. This question describes the client responding correctly to a new stimulus, the instruction touch elbow, that is similar to previously trained stimuli. Touch head, touch nose, etc. The client learned a general rule or concept, identifying body parts based on the name, and applied it to a new example. This is stimulus generalization, responding in the same way to a new stimulus that shares characteristics with previously trained stimuli. Since it's happening within the skill of following instructions, listener responding, it's stimulus generalization within that repertoire. Prompt dependency is needing prompts to respond. Discrimination is responding differently to different stimuli. Response generalization would be performing a new behavior in response to a known stimulus/instruction. Here the behavior is the same, pointing, but the instruction, stimulus, is new, demonstrating stimulus generalization. Question 71. You are teaching a client to imitate tapping their head. You say, do this, and tap your head. The client taps their stomach instead. What type of response is this? A. Correct response. B. Prompted response. C. Incorrect response. D. Independent response. Answer C. Incorrect response. This question is about classifying a client's response in a teaching trial. The instruction/model was do this, and you tapped your head. The client tapped their stomach. Since the client's action did not match the target behavior you modeled, it is an incorrect response. A correct response would be tapping their head. A prompted response means they did the correct behavior with help. An independent response means they did the correct behavior without help. This is simply an incorrect attempt. Question 72. A client has a problem behavior that sometimes occurs. Your supervisor asks you to take data on the behavior using partial interval recording with 1-minute intervals. You observe for 30 minutes. How many intervals will you have data for? A. 1. B. 10. C. 30. D. 60. Answer C. 30. This question is a simple calculation related to interval recording. The observation period is 30 minutes. The interval length is 1 minute. To find the number of intervals, you divide the total observation time by the length of each interval. 30 minutes/1 minute equals 30 intervals. So you will have 30 data points, one for each minute-long interval. Question 73. An RBT is using a token economy system. The client earns tokens for completing tasks and can trade them for access to preferred activities. The preferred activities that the client can trade tokens for are called A. Conditioned reinforcers. B. Primary reinforcers. C. Backup reinforcers. D. Punishers. Answer: C. Backup reinforcers. This question is about the components of a token economy. In a token economy, the tokens themselves are conditioned secondary reinforcers because they gain value by being exchanged for other things. The things that the tokens can be traded for are called backup reinforcers. These are the items or activities that ultimately provide the reinforcement. Primary reinforcers meet basic needs. Punishers decrease behavior. The preferred activities are the backup rewards you get with the tokens. Question 74. An RBT is working with a client who exhibits aggressive behavior. The BCBA's Behavior Intervention Plan, BT, lists specific steps to follow if aggression occurs, including how to safely block hits and when to call for help. These safety procedures are crucial components of the BFP, emphasizing the importance of A. Using positive reinforcement. B. Proactive strategies. C. Reactive strategies. D. Data collection accuracy. Answer: C. Reactive strategies. This question asks about different types of strategies in a behavior intervention plan. While positive reinforcement, A. Proactive strategies, B, like antecedent control, and data collection, D, are all important parts of ABA. The specific steps listed, how to safely block hits and when to call for help, are procedures implemented in response to the problem behavior happening. These are reactive strategies, actions taken during or immediately after a challenging behavior occurs to manage the situation and ensure safety. Proactive strategies happen before the behavior to prevent it. Reactive strategies are about how you respond when the behavior happens. Question 75. You are observing a client during a play session and notice they spend a lot of time lining up toys. Your supervisor asks you to find out how much time the client engages in this toy lining behavior each session. Which measurement method should you use? A. Frequency. B. Duration. C. Latency. D. Momentary time sampling. Answer: B. Duration. This question is about selecting the appropriate measurement method for a specific behavior. The supervisor wants to know how much time the client spends lining up toys. Measuring the total time a behavior occurs is duration recording. Frequency would count how many times they started lining up toys. Latency would be the time from a cue, if there was one, to the start of lining up. Momentary time sampling would only tell you if they were lining up toys at specific points in time. If you want to know the total time spent on the behavior, use duration.